You guys helped save our son's life.
Before you come to work at Neighborhood Health Plan of Rhode Island, you should know.
Ever since I went with Neighborhood Health, I was able to control my asthma.
This isn't a normal insurance company. One way you can tell? Well,
I'm a new man now.
Insurance companies typically don't have customers who talk about them like this.
It makes me feel so loved, so wanted.
To find out what's so special about Neighborhood, you have to go back a while.
There's a different way to be a health plan, and we're doing it.
From the start, Neighborhood Health Plan of Rhode Island looked at the world through the eyes of its members.
If we have to take sides, we'll stand with the patient.
Neighborhood was born in 1993, founded by the state's community health centers, or CHCs. Our first members were exclusively moms and babies enrolled in the state's Right Care program, which worked to make sure families with low income received the access to the health care they needed.
Our hopes were that we could increase immunization rates for children, increase prenatal care for mom, to be able to really have an impact by developing a primary care home for our patients. And in fact, that's what's happened.
Compassion and deep empathy inspired Neighborhood's very first employees. Every day, they focused on how to protect vulnerable newborns. The type of culture that kind of motivation creates is powerful. So much so that it lives on today.
What hasn't changed here at Neighborhood over the 15 years that I've been here is what drives us is our commitment to making sure that the members are taken care of.
Gracias a la iniciativa de Neighborhood Health Plan of Rhode Island.
From the start, it was clear Neighborhood needed to be inclusive. Commercials like this one reached out to the Spanish-speaking community to let them know Neighborhood was an option. But the diversity of our members was just the beginning. Every bit as important to us, making sure our diverse staff reflects the community it serves.
When I see people coming from other countries looking for help, I think it triggers those memories of when I was little and when I saw my parents go through and my family. So I want to help them out that much more.
For me, growing up in this community, I know what it is to struggle. It's nice to see that I can make a difference.
A lot of our work happens in members' homes. Neighborhood knows it takes a team to keep people healthy. We look at the whole person, everything going on in their lives, before we develop a healthcare strategy. And members notice.
Now I care about everything. I care about me. I care about people around me. I care about life. It's great now.
Neighborhood is also an essential partner in the community. You'll always find our employees volunteering their time to support local charities.
Welcome to the new staff meeting. This is certainly a different model for us.
Back in the building, maintaining an inclusive and empowering culture is always a priority. Every month, all staff meetings bring everyone together, which is especially important since we're growing so much. Neighborhood staff doubled in size from 2013 to 2016 and will continue to get bigger to match the growth of our membership.
Neighborhood is a quilt, and Neighborhood has been a quilt of the same size for many, many years. We have more recently added more pieces to that quilt. We've added squares. Our culture is how we bind those squares together. That culture is really about our members. It's always member first here.
There's always a job, right? You can always go work somewhere, you can find something, but when you find a place that you feel connected to the employees, connected to the members, I skip into work every day. I look forward to coming into work because of all the great things that we're doing.
Working at Neighborhood, you'll be part of a successful company, but one where profit isn't paramount. That might sound weird, but our ultimate goal is to keep the price of insurance low so that everyone can afford it.
Rhode Island healthcare is different from any other state in that it's very connected. And Neighborhood is Rhode Island's health plan.
We are in this business to protect people as partners with the state, as we have from day one.
We can stand up organizations, we can make metrics work, we can put all the data together, but if it's not in the heart of the people who are working it every day, it doesn't work. And at Neighborhood has that heart to make it work every single day.
And that's why we updated our decades-old logo in 2016 to this one. Neighborhood's heart is what makes us, us.
This is the best job I've ever had. And it is because the people work here are energized, they believe in the mission, and it's fun to work here. It really is. People really like being here.
And as we grow, our mission evolves. Small businesses that have struggled to afford health insurance for their employees now have an ally in Neighborhood.
In terms of numbers, we don't have much turnover, and there's a good reason. People like to work here and they find real meaning in the work.
When you come to work at Neighborhood, you're joining a movement to make the entire healthcare system more just and more equitable. We have intentionally blurred the line between health insurer and advocacy organization. Joining Neighborhood means you share in our mission to serve some of this state's most at-risk people.
No matter what conversation you're in, whether it be a finance conversation, tracking metrics conversation, or actually in a conference room, member first is really on top of everybody's agendas. How are we going to make it better for the member today? And I think that's impressive.
Absolutely sure. Any day you work at Neighborhood, that you can point to something that you did that made a difference for somebody in Rhode Island.
It's something we've been doing very well for a long time, a proud tradition we expect you will carry on.